I actually got the privilege of meeting the speaker when I was first considering running for office at a workshop where you have volunteers just listen to random ideas that you have. Little did I know that this core person who was sitting there so humbly listening to me usually advises presidents and presidential candidates. But to me, Benita Maraju has been spearheading campaigns at the federal, state, and local levels for more than 20 years. She is a champion for reproductive rights and gender equity issues, and has been a senior leader with Planned Parenthood. It is currently the president and CEO of Reproductive Freedom for All. Please help me welcome to the stage to fill us in on the landscape of reproductive health, Benita Maraju.
Okay. First of all, doctor, thankful all doctors. So I was going to make a doctor joke. My colleague Nisha was like, you're the only one on here who's not a doctor. I was like, man, you're just chilling with parents. Right? Come on. I'm not a doctor, I'm not an engineer, explainable lawyer. I don't really never pass the bar exam. I'm giving you all of my personal shame right now as sort of a public process to it's okay. You don't have to be perfect, right? The mental health journey. And also, Dr. Bosa wanted to mention, this isn't in my remarks, but I made some notes. In this third, you did touch me and affect me. So I'm going to share a couple of things for you, for the group. Mental health in my family. I have a grandparent with bipolar disorder. I have a very close aunt who's really struggling with extreme dementia in her final years. We have anxiety, depression. I suffered from anxiety and depression in college and in law school. And it really was tough to talk about. It was tough to acknowledge in the community. So I'm doing that. I'm acknowledging it in public. I've talked about it a little bit, in my own world, but I'm doing here in this audience because I think it's really important for all of you to see you can struggle with those things and still have these full, rich lives, right? You can still have the public appearance of success that had a struggle. And we shouldn't be struggling with these things alone. I have no shame the fact that I take anti-anxiety medication. I see my therapist, who's amazing. I've seen her over 15 years. And I absolutely not have my role in life and the privilege of doing the work that I get to do if I did not seek that help and I did not have family around me who encouraged me to have that help. So thank you for your work. And again, shame. It's second for your choices, so I'm going to have to figure out this doctor thing. All right. All right, so I'm going to get right into it. We've got a problem, right? We have an abortion access crisis. In the years since Roe was overturned, it's been 2 years. It will be 2 years to the end of June. 21 states have banned or severely restricted abortions because of bans, and millions of South Asian people across the country are being blocked from the care that they need. And attacks on reproductive freedom are a direct assault on AAPI communities and South Asian communities. I'm going to quote and cite a couple of our colleagues and allies in the fight. I'm really privileged to serve on the board of the National Asian Pacific American Women's Forum, NAPA. They've got research that shows 7 out of 10 Asian Americans support legal abortion. 85%, that's about 5% more than the average population, believe that pregnant people should have the freedom to make their own decisions about reproductive health care. So from our community standpoint, when you're doing electoral work, community outreach, this is not a controversial issue. And we found for a long time that it's not a controversial issue. In fact, my anecdote was when I first started working with Planned Parenthood over 15 years ago, and my last couple of jobs ago, I went to India to see family. And all my aunties are like, I don't understand what your job is. Like, are you from the government? Because that's just family fund, right? Why do you have a job? I'm like, well, I lobby. Why do you need to lobby? And is it funded? It is not. Let me explain the whole evangelical movement and the extremist right wing and the anti-abortion movement. And they thought it was the most bizarre thing they'd ever heard, right? Because in our culture, our communities, this is something we assume we could have. It's something it's always been that way in South Asian communities, but it's been that way for a long time. So, this is important. And why is this relevant to us? Even though we don't talk about sex and sexuality, another source of shame and stigma in our communities that's really dangerous for our young people. And is a direct correlation, Megan's nodding down the street once, because direct correlation between that and domestic violence, right? We don't talk about sex. We don't talk about sexuality. We don't talk about intimate partner violence. So it's a slippery slope, and it puts a lot of our folks at risk. But about a third of our pregnancies in our communities end in abortion. A third. So it's really important. We don't talk about it, but we are definitely using that service. We need that care. We need that critical care that really helps so many of our communities. So this is really critical work. We know that our community is impacted, and we now know through the data, the research, that we deeply care about it. We're deeply concerned about it. So even before Roe, though this is important, I talk about this a lot, it's for the Dobbs decision. Before Roe v. Wade was overturned, there were significant restrictions on abortion access in this country, and many folks like us were caught in those crosshairs. It's a really important case, and it's over a decade old. A woman named Purvi Patel. How many of you remember that story? All right, good. Not enough people, so I'm going to tell the story. Then, of course, the doctors too. Purvi Patel was a young woman in Indiana who was prosecuted for an alleged abortion. She had a pregnancy outcome. She was scared. She had shame. She was vulnerable. She hid her pregnancy outcome, which ended in a termination. And she was prosecuted by the state. This is important because when women of color, particularly now post-Dobbs, when we have states with abortion bans and restrictions, it's communities like ours that get caught in the crosshairs, especially young immigrant community members, right? So that's what happened to Purvi, and that wasn't that long ago, and that was while Roe was the law of the land. Another really famous case that didn't happen in the United States, but it's important for all of us as Indian Americans to remember, is that Savita Halappanavar. Do you know that story in Ireland? Yeah. Okay, so Savita was a 31-year-old dentist. So this is important. Medical professional, highly educated, immigrant to Ireland, where she came to support, communities. She died of sepsis in Ireland after her request for an abortion was denied. There was such incredible public mobilization and outreach around her case that since then, Ireland has changed laws on abortion. And that was all because of somebody who was an immigrant to the country, but somebody who looks just like us, who needed that life-saving care. So, and then since, the Dobbs decision, I think you've all seen some of these really high-profile cases like Savita's in this country. Amanda Zarowski, Kate Cox, Dr. Austin Nard, the Biden-Harris campaign is doing a lot of work, amplifying their stories. So we now know that abortion care is something that you could need at any course of your pregnancy, and that pregnancy is actually one of the most, if not the most dangerous time in a woman's life. So why do we not want that care for all of our communities? Analysis from our partners at the National Partnership for Women and Families has found that state abortion bans could harm nearly 15 million women of color. That includes 1.3 million API women. So we know that we're at greater risk to racial profiling when seeking abortion care. We know that anti-immigrant sentiments and sex-selective abortion bans, which is a thing that really targets API communities, by the way, across the country, and the legislators could tell you all about that, really stigmatize Asian American patients and communities that were seeking pregnancy care. So when we talk about reproductive freedom, we're talking about more than just abortion care. We're talking about this broader range of issues that impact how we decide if, when, how to have a family. And we're a family-oriented community, right? We came here to get the best for our kids, the best for our families. We absolutely should have that fundamental freedom to decide. But here's the good news. Every time abortion is on the ballot, abortion wins. This is really, really important. We haven't lost yet, but we're not having any losses this November, thanks to all of your support. Voter outreach to South Asian voters in battleground states shows that this is one of the top 3 issues on voters' minds, and that our voters have tremendous power. It's a top priority in findings from the organization. This is really exciting, called South Asians for Abortion. And I'll make sure you guys all have the link. They're doing tremendous work. Findings from their organization show that 55% of Muslims and 68% of Hindus believe abortion should be legal in all of those cases. And in the Sikh American community, 59% have either had an abortion or know someone from their community who's had an abortion. This is important because so many arguments against reproductive freedom and in favor of abortion bans are about faith, right? They try to connect to conflicts between religious beliefs and access to the care. We already knew intuitively, culturally, that wasn't an issue for us, but now we actually have a public opinion poll, which is really important for us to share with candidates who are doing outreach to our communities, right? You should talk about abortion care. You should talk about reproductive freedom. And we know that there's socioeconomic challenges as well that make it harder for our communities to turn out, so that's important for us to address as well. So finally, I was asked to talk about how you can all be engaged in this fight with us. So absolutely want to encourage you to support our friends at the National Asian American Women's Forum, our friends at South Asians for Abortion, and of course, we want to invite you to join us at Reproductive Freedom for All. We have 4 million members across the United States who've been mobilizing for more than 50 years. We used to be called NARAD Pro-Choice American. So if you hadn't heard our name before, we just changed it last year. But we're so super proud of the 50 plus years of work we've done. And I'll say on a personal note, I am the first person of color to run the organization. And I know you first need to get an airplane. And I'm also the first immigrant. I came here as a child, so I'm an immigrant too. So in this moment where we've got some really toxic, xenophobic, attacks on immigrant communities, but also reproductive freedom is the #1 mobilizing issue on our side. It's really important for more folks like us to be standing in that gap and say it's not just about care for everything, it's also care for us and our unique needs, immigrants, and folks who sit in that gap of language access, immigration access, cultural competency, etc. So finally, I'll say research shows, so this intuitively, that you are the most powerful and trusted messenger in your community. Not me, not a celebrity, not the president, maybe the vice president. She's incredibly effective on this, and she's of our community. But you are the most trusted person in your community on this issue. So we need you to join us. Get out in your community to talk about this. We can coach you and train you on the talking points and the messages. But also, what's really more important is your personal story, your pregnancy experience, your family's experience with reproductive freedom, forming your family. In my case, we adopted our children. Even talking about all different ways that I should have the right to decide how to be married, how to have my kids. This is fundamentally what changes hearts and minds, that helps us win on these big fights. And there couldn't be a more urgent time to do it. Our lives and our great freedoms depend on it. Thank you, Impact, for having me. It's so good to see all of you.
Thank you so much, Benny, for advocating for all of us and helping us become better advocates. As we're talking, I couldn't help but think, yes, the shame about sexual and reproductive health is so real. I work in sexual and reproductive health, and then mother still, at the age of my 30s, that's forced through kissing scenes in movies. That's all. But our next speaker is going to take us into the world of drug pricing and Medicare. Dr. Nina Shishmati has led so many lives in this short span of her life so far. She is an otolaryngologist who taught at Georgetown University as assistant professor. She was a VP at Clinical Care Transformation at MedStar, and he served as a leader in the Biden-Harris HHS agency transition team. Now she's the director of the Center for Medicare and has 3 insights that will enhance all of us now and well into the future. So I'm looking forward to hearing your thoughts. Thank you so much, Megan. And it's really wonderful to be here with all of you. And I think, I was asked to speak about prescription drug pricing and caregiving, which we see like disparate topics, but actually are not, as we will talk about. And I think both topics that really hit home for our community. So, starting with Dr. Kandula had shared the research with the Masala study about how our community is at higher risk for diabetes, cardiovascular disease. Well, as you may know, thanks to the drug law that President Biden signed into law, we are now in the process of negotiating the first 10 drugs for the Medicare program directly with drug manufacturers. And guess what drugs these are? For diabetes, blood thinners for heart disease, a drug for heart failure, it is very relevant for our community to be aware of this work because it will directly impact our communities and the disparities that our communities face. And importantly, for me, bringing the lived experience of having immigrant parents, having to deal with, different culture, the barriers that ensue in this negotiation, one of the things that we've been asking is, how do these drugs address an unmet need in our communities? How are they benefiting people in the real world, not just in some sterile, randomized controlled trial? Because I don't know about any of you, but my life is far from randomized and controlled. And how are they impacting different populations so that we can make sure that everything that we do, even drug negotiation, is addressing the disparities that exist in our country? And beyond that, the drug law has been so critical to bring down the cost of prescription drugs for our nation's seniors. As you may know, the Medicare program, which I lead, cares for more than 65 million people in this country. I'm sure all of you know someone on Medicare, and all of you at some point will be on Medicare. And we pay almost $1 trillion in claims each year. So now, thanks to the drug law, nobody has to pay in Medicare more than $35 a month for a covered insulin product. Life-saving medications were previously, sometimes people were paying up to $400 a month. Vaccines are available at no cost out of pocket. And next year, nobody in Medicare will have to pay more than $2,000 a year for prescription drugs. I cannot tell you the stories that I have heard around the country of seniors who are oftentimes on fixed incomes, right? Paying $7,000, $8,000, $13,000, and not having the certainty of an end to that, right? Each year, it's an unknown amount because it'll just keep going up and up and up. Now, that doesn't happen anymore. $2,000, that's it. And how this really relates to us, aside from the additional risk factors that all of us have that lead us to take some of these medications, but also, as has been discussed, we definitely are a family-oriented community. We have that strong social fabric. So it's not just the person trying to take these medications who get affected by these issues. It's all of us. It's the people who are caring for those. I will tell you, as I was driving here to give this talk, I was on the phone with a health insurance company trying to navigate some prescription drugs for my own family. They didn't know who they were talking to. But I think it is important for all of us to remember, there was one woman who I spoke with whose brother couldn't afford his insulin. And rather than acknowledge that to his family members, he was rationing his insulin. And when she found out, she started giving him money every month, no questions asked. And she said, what a relief it was for her when the $35 insulin copay cap came about. So she doesn't have diabetes, but she is a member of the community. She is a caregiver. So everything that we're doing has that tremendous impact on our community. And it is only as good as people knowing about this. So I'll give you another example. So now we have all of these great changes that we've made to the Medicare program, but you can't expect everybody to just wake up and say, oh, let me go find out if, something has changed. So we had made over-the-counter COVID tests, you may remember. We had made over-the-counter COVID tests free for people in Medicare. This was in April of 2022. It was a pretty big deal because it's the first time in the history of the Medicare program that we have found a way to make an over-the-counter product free for people in the Medicare program. So it's like Washington Post, New York Times, everybody's covering it. So fast forward to September, I'm having brunch with my parents, who are both on Medicare. So I'm having brunch with my parents and my kids. And my mom was like, oh, you can't get the COVID tests anymore through the post office, like covidtest.gov. So I guess now I don't know how we're going to get our COVID tests. And I said, Mom, you can go to the pharmacy and you can get 8 COVID tests a month on Medicare. And she said, are you sure about that? I feel that. So yes. And then my 11-year-old chimed in, Mommy, Mommy worked so hard to make that happen for you. Go use it. So again, my own parents I run the Medicare program. They didn't know about that. But I think it's a testament that all of us, all of this good work, we need to get out there and share with those in our communities. And I think also we have been doing a lot of work in the caregiving space. Again, this is something that really is personal for me, as someone who, again, to quote my child, "Mommy, you take such good care of 65 million people, and you take such good care of us. Who's taking care of you?" But I think, we are all caregivers. And, and as our nation ages, the caregivers are going to be the backbone of our healthcare system. And yet they have often not been recognized or supported. So now in the Medicare program, for the first time in the history of the program, we are paying for caregiver training. So, I can say as a surgeon that there were many times when I had someone post-op in the hospital where, they're well enough to go home, but they've got a feeding tube. They can't get up and toilet themselves. They can't transfer. And you just hope that somebody's going to be at home to help them. Well, now healthcare providers will get paid by Medicare for providing training to informal caregivers. That is key. Also, paying for community health services, paying for care navigation when people have a serious illness so that they can have support in knowing how to navigate all of the various doctors and tests and, prescriptions. All of those things are first of its kind in the Medicare program, which, to be honest, is a little shocking that it takes that much to really change the healthcare system, because we all know that this has been occurring in the background. But again, another theme that has been spoken about so far, it's something that's been occurring in the background, but people haven't been talking about it. And if you don't talk about it, then it doesn't change. So that's why it's so important that we are out there saying, yes, these are necessary services that absolutely should be part of healthcare, because healthcare is not just about treating a disease. It's about caring for a person. And I don't know about all of you, but I am more than the sum of my ICD-10 codes. I am a full person, as all of you are, and making sure that our healthcare system is really acknowledging that and supporting that. And the work that we are doing in caregiving extends beyond maybe some of these more obvious examples. My parents, again, on Medicare open enrollment comes around. My dad's like, "Mina, when are you going to take care of all of these ads that I'm getting bombarded?" Or questions of, so now there's a grocery card, so should I change my plan because now I can go somewhere else and there's a grocery card? No, Dad, because you need to make sure that your doctor is covered by whatever plan you're on. Fortunately, they have someone like me who they can talk to. Not everybody does. And yet caregivers, oftentimes the ones who are supporting people in the Medicare program, trying to make decisions about what options, what plans are best for them. So we have cracked down on misleading marketing practices. In the last Medicare open enrollment, we rejected more than 1,000 television ads that we found to be misleading for our nation's seniors. And I'm sure many of you can relate about calling up insurance, care was denied, well, we need this care, we have to get this treatment. Again, that oftentimes falls on caregivers. And we heard about this a lot from people in Medicare, where in Medicare Advantage, they weren't able to get the care that they needed. Or they got approval for the care they needed, but not for the full course of treatment. So partway through the course of treatment, they are going back again through the hoops trying to get the full course of treatment authorized. So we've made quite a few changes here too, where if traditional Medicare has a coverage decision, the health plans have to follow it. No ifs, ands, or buts. If they're approving a course of treatment, it has to be approved for the entire course of treatment. And again, a lot of that is being done with all of you in mind, with thinking about what it is that our communities face and how we can make sure that our programs are serving everyone. And I think the last point that I'll make is on language access and meeting people where they are. As we all know, people talk about how AA and HPI is a diverse community. How about within South Asians, right? The number of people who come up to me and start speaking to me in Hindi, and I say, no, I'm actually from Tamil Nadu, right? And so, we have been trying to take that into account with our policies. So, for example, health plans now, if they have at least if they have a threshold of 5% of their enrollees who speak a language, they have to provide that enrollee with all the materials in that language. So it is not a one size fits all. Every part of the country has different communities and different languages. And so we're trying to embody that in what we are requiring healthcare organizations to do. And again, I think a lot of that comes from the lived experience that all of us have had, where we've all had family members that we've had to do translation for, where we've all had situations like you mentioned about the vegetarian diet, where it's like, oh, well, you know, if you have heart disease in your family, just eat vegetarian or just eat a Mediterranean diet. Well, I'm vegetarian. Oh, well, if you're vegetarian, you should be fine, but I have heart disease in my family, right? Being able to understand the nuances of the diversity of our country and what that means for caring for people is something that we have really taken to heart in the Medicare program. And again, this is what I hope for all of you that you are able to take forward. Again, it is really incumbent on all of us to make sure that we are supporting our communities and making sure that the good work that, for example, the team in Medicare is doing is actually getting out to change lives. So, you know, thank you again for having me, and I'll turn it back to you, Mike. Thank you, Dr. Sachvani, for really the pivotal work that you all are doing at the Center for Medicare that will enable so many of our family members and even us in the future to age gracefully at home. Our next speaker is a familiar face to many people in this room. Dr. Bin Gupta is a senior medical analyst for NBC News and MSNBC and comes into our living rooms quite frequently, so you'll probably recognize him when he comes up here. He's also a pulmonologist who is affiliated and teaches at University of Washington. In addition to that, he is a major in the U.S. Air Force Medical Corps and also serves as the CMO of Amazon Health Services in his free time. Please help me welcome to the stage Dr. Gupta to shed so much light on the hot news.
Good evening, everybody. I promise to keep my talk Enlighten. And I did want to say just, it is a personal thank you for the invitation. As a specialist in behavioral practice, Shgudas, Director, Dr. Shismani, Dr. Sobit's Tim's House. I wanted to focus on the future because I know that everything that you've heard from just the data, everybody right now is just been focused on what's being done, what's going to be happening in years. What's going to happen in 2021 to 24 is going to be the focus of my 5 minutes. But, you know, I'm a pulmonologist. I see patients at the bedside in the ICU often because a lot of downstream or upstream impacts on their healthcare, their access to healthcare something has gone wrong. They've ended up in the ICU quick loans. And so much of what we talk about now is, well, gosh, how do we keep people out of the hospital? That's equity, that's access, the topic of my talk here. But how are we thinking about that in the broader set of challenges that I know we're facing as a country, as a world? And really, any talk on equity and access needs to focus on environmental health. I don't say this too just as a lung doctor, but as somebody, again, at the bedside that's seen the impact of changing environment on the human body. And up until just maybe the last 18 months, I have to say, I didn't have much out. Because here, I live in Seattle, Washington, and in the standard 12 months, our home is that you retrofit the home for AC. It's unheard of in the Pacific Northwest. That's something commonly do in the Pacific Northwest. I know DC it will. We also had to put piping and foam piping around hertz bars to be furnace. So would I snap? In 12 months, we had two things for an HVAC system that we can think we needed to do in prior 40 years. I kind of used to live that. And so the climate around us has changed in ways in which, like, again, 12 months ago, I think maybe we wouldn't be having this conversation with Urchin Tones and Mr. Abbey now. But I remember friends in New York City coming and talking to me last year and saying, what should we do? This looks like Seattle, Washington in the middle of July here in downtown Midtown Manhattan. What are we going to do about this? Obviously, this was a focus of media, being the media capital of the world. What are we going to do here? It looks like catastrophe. It's like end of days right here in New York City. And I think if you look at, as we barrel down the speech before election calendar, as we looked November 2023. We think about what the EPA has done under President Biden. To me, it's pretty incredible. And I think we don't talk enough about it in a very cogent way. But what has he done? We've wanted in healthcare for so long. He said that asbestos now, the EPA has actually said needs to be banned for construction. Or that PFAS, these plastics, these chemicals that we barely ever talked about up until 6 months ago, now need to be regulated, removed from our tap water. That public drinking supplies need to be actually monitoring something that in 15 years' time, I bet we're going to get told is actually causing things like early stage cancer. We think that's the hypothesis now. 50 years, it's probably going to look a lot different. What else is he doing? Mandating electrical vehicles. I know that's politically hot button. But what is that? What are we talking about when it comes to clean air? EVs mean something when it comes to clean air. Combustion gasoline vehicles are the worst contributor to poor air quality outside of wildfires. That's a big deal. And that's a combination of the Inflation Reduction Act and what the EPA is doing. What is the EPA doing as well? Telling polluters, power plants, that no, it's no longer a suggestion. You must clean up and coal-fired emitting power plants. You must clean up what you're doing. You must do it now. So if the EPA is doing its job, but the Inflation Reduction Act is doing its job, we need this moment. Because again, I think about 21, 24, everything you heard today on mental health from Dr. Balsam, all the incredible work truly coming out of Medicare. It's just incredible listening to all that activity, everything that you're doing to characterize the epidemiology of heart disease, Dr. Kandula. It's truly incredible work, media and your work in reproductive health rights. All of this is going to be perfect. All of this is going to be having a long period of that. But if we think about 21, 24, what our grandchildren are going to be focused on, I would bet one through line is going to be environmental health. And how do we deal with that in a sustainable way? So don't look past sometimes the fold of the newspaper. What's often missed on the fold of that newspaper is, gosh, EPA has done yet another thing that you wonder, why did it take so long? So that's one. I'll close just by saying something here, and this is leans into my role in health technology. Again, as a pulmonologist, I think we often see patients who end up in the hospital with severe illness who didn't present to care. If they had just gotten seen in time, if they had just got one of those over-the-counter tests that Dr. Seshmani and her team at Medicare had provided free of charge, or if they had used their benefit at the pharmacy counter, maybe they would have known they had disease earlier. Maybe they would have intervened earlier. They would have stayed out my ICU. That's changing. Whether it's Amazon, the work that we're doing in Amazon Health, whether it's our peers across the spectrum in biotech, what are we doing? What do we see? We're seeing the FDA under Robert Califf, close colleague, and where I actually a clinical metro line when I was coming up with things. What is he doing in the FDA? I'd say as consequential a tenure as Dr. Seshmani is having in Medicare, he's doing something similar to the FDA. And again, we don't talk about it. Just like we don't talk enough about the EPA and how significant their work is when it comes to environmental health and justice. What Dr. Califf has done at the FDA under President Biden is incredible. OTC naloxone for opioid overdoses. Basic. Again, wow, we had to actually do that. We would have thought maybe that would have been done earlier. OTC oral contraceptives if media is there. Yet another option for women's health at a time when women's health is being attacked. OTC COVID flu tests now. It's not just COVID-19, it's COVID flu. As a pulmonologist, that means something. Sniffles can mean more than just COVID. So we think about the patient. We think about health access and equity. It's about driving meaningful healthcare to the home. Empower patients with the right tools at home, but making sure we have a progressive regulatory environment that is not putting up a bunch of red tape, that's looking at these innovations in a way that says, okay, this is great, this is safe, this is effective. Let's get this in the hands of patients as quickly as possible. So again, I would just say so much great activities happening. My incumbent conservative leaders, some of which are table here today, we should talk about it. We should talk about it in a patient-centric way. We should embrace it. But we should also look to 21, 24 and what's going to be the through line. And that's going to be environmental health. So thank you again for your time. Appreciate it.
Let's give it up one more time for all of our incredible health teachers and facilitator Dr. Shreya. I'm Sarah Sean, the Senior Director of Partnerships and Communications with Impact. You are going to hear a lot from me the next 2 days. Probably got a lot of emails from me. So I'm not going to take too much time now. Yeah, we're running out Indian Standard Time. But hopefully, again, shout out to our healthcare speakers. Every single one of you just doing such amazing work. So thank you for charting the path forward. We are going to, for the next couple hours, we are going to be transitioning to breakout sessions. So you have the opportunity to choose from 1 of 4 concurrent sessions happening. Yep, there we go. On slide. I want to thank especially all of the leaders for these sessions. We launched a call for proposals a few months ago. We received dozens of proposals. And so this is really, truly a community-led movement. And all of the leaders, organizations, thank you for the time and the thought you put into your session. As attendees, we ask that you please respect them and their time and what they have to share by showing up. I would say on time, but, and we'll start a little late. But engaging deeply with their programming, they have so much to offer. And so right now, you love the program. The program is in your tote bag. It's a booklet. There's also a QR code on the back of your name tag. But there's supposed to be a break right now. Well, supposed to be in the next session. The parent can please, so that we can give our sessions the time that they deserve. Head to your breakouts. And in here. The other 3 are upstairs. So the Burnett, one's in West End, which is down the hallway, and then 2 are upstairs. And you will go there, and then after that, we're going to transition to the next breakouts. We're going to be switching up our afternoon program a little bit, just on the trust on this. But also wanted to flag one change in your program. This session, you can see the sessions coming up. The session at the 2:45 block, and we'll repeat this in the next session, but we're switching a couple of sessions. So just pay attention in your breakout to the schedule changes. But for now, thank you all so much for joining. Please head to your breakout rooms. We'll see you back here later this afternoon.